How come last week you said there were 14 layers of management between the patient and the CEO in Health New Zealand?
Oh, well, you can argue any way, but there's a huge amount of bureaucracy in the system, as you would go talk to any doctor or nurse outside of this building and say, what's it like dealing with the system? There's 2,500 extra management and back office people that have been hired in the last 6 years. There's very convoluted and confusing organisational structures, massive amounts of bureaucracy.
It's not convoluted enough to generate 14 layers of management.
Sorry, say that again?
It's apparently not convoluted enough to generate 14 layers of management, because when asked, your government couldn't provide.
Well, the advice I've been given is 14 layers of management. I think there's other components of corporate services and things that may or may not have been included, but I just say to you, it's obvious to anybody. Go talk to someone in the system and find out how bureaucratic it is, and it's incredibly bureaucratic.
You claim a number of times, you referenced 14 a number of times.
Yes.
Where did the advice come from if it's not correct?
That's the advice I've received from the Minister of Health. Yeah.
It's not. Is it a problem that it's not correct? I mean, his office provided the list, and it includes the 14 includes the patient, the board chair, the chief of staff of the CEO.
All I'm just saying to you is the advice I've received is that there's 14 layers of management. Some cases, I just say to you that what's been counted, we can debate. All I'm saying to you is leave this building, get outside the bubble of Wellington, and you'll see that that's actually a real problem for people.
Is it debatable that the patient is a manager at Health New Zealand?
No, it's the difference between the patient and the CEO range. There is layers of management, and there is 2,500 extra back office staff and management, admin, and support that have been hired over a 6-year period. I don't think any of us would disagree that it's actually been a botched restructuring and a botched merger that actually hasn't delivered an efficient operating model, and that's obvious when you talk to the frontline staff, the doctors and the nurses at the front line.
You said that there were 14 layers, and there aren't 14 layers.
And I've told you the advice I've been given by the Minister of Health was that there was 14 layers.
Don't you double check the advice that you're given before?
I received the advice, and I can tell you there is huge layers of bureaucracy, and that's what the good news is. We took action last week to put a commissioner in who will actually make sure it's a lean operation focused on patients and delivering those improved outcomes.
Do you need to go to Dr. Reti now and say, hang on a minute, what happened here? You know, the list of 14 doesn't quite stack
Well, I'm sure
up.
those are questions you'll direct to him in the next few days.
Did you say that you also relied on him for Dargaville?
Sorry?
Didn't you also just say you relied on him for Dargaville, saying that those patients, that the people in that region are safe, and yet...
Well, I do. As Prime Minister, I rely on my Minister of Health and Health New Zealand to make sure that we've got good operating practices and safe operating practices across our health network.
Advice which is inaccurate, then shouldn't we be questioning those ministers?
Well, I'm just saying to you, you asked where the advice came from. I've received that advice, but all I'd just say to you is 2,500 extra folk hired in admin management support functions over the 6 years. Yes, you can. Absolutely. Yeah.